Who administers the Bayley Scales test? Have you ever wondered who is responsible for administering the Bayley Scales of infant and toddler development? This test plays a key role in assessing young children's development, especially in the context of autism spectrum disorder. Let's break it down. The Bayley Scales are typically administered by trained professionals who specialize in early childhood development. This group includes developmental pediatricians, psychologists, speech-language pathologists, and occupational therapists. These experts have the necessary skills to evaluate a child's developmental progress effectively. Administering the Bayley Scales is not something just anyone can do. It requires specific training because the test involves structured interactions with infants and toddlers. The goal is to assess various developmental domains, including cognitive, language, motor, social-emotional, and adaptive behavior skills. During the test, the examiner follows standardized procedures to observe and score the child's performance on tasks that are appropriate for their age. This careful observation is essential to gather accurate data on a child's abilities. In the context of autism spectrum disorder, the Bayley Scales are often part of a broader diagnostic process. Professionals conducting autism evaluations, like developmental pediatricians or clinical psychologists, may use the Bayley Scales to assess cognitive and communication skills. These areas are often affected in children with autism spectrum disorder. The results from the Bayley Scales help differentiate between global developmental delays and specific language or social impairments. This distinction is vital for creating effective intervention plans. The Bayley Scales can be administered in various settings, such as clinical environments, early intervention programs, or research facilities. The test is designed for children from about 1 month to 42 months old. This age range makes it suitable for identifying developmental concerns early, including those related to autism spectrum disorder. To sum it up, the Bayley Scales test is administered by qualified professionals trained in developmental assessment. These experts include developmental pediatricians, psychologists, speech-language pathologists, and occupational therapists. The test evaluates multiple developmental domains and is a key tool in diagnosing developmental delays and autism spectrum disorder. Proper administration involves standardized procedures and careful observation of the child's responses, providing important information that supports early diagnosis and intervention planning.